This animation is going to tell you a little bit about what the eye is, what glaucoma is, and what to do if you have glaucoma. The eye is a sphere-shaped sense organ which allows for vision. There are three main parts of the eye, called chambers: the anterior chamber, the posterior chamber, and the vitreous chamber. The anterior chamber is the front part of the eye between the cornea and the iris. The cornea is the clear window at the front of the eye. The iris is the colored part of the eye and is a group of muscles that control the size of the pupil. The iris will constrict, causing the pupil to get smaller when in a bright environment, and it will dilate, causing the pupil to get larger when in a dark environment. The posterior chamber is between the iris and the lens. The lens is behind the iris and focuses the light that enters through the pupil onto the retina. The vitreous chamber is between the lens and the back of the eye, which includes the retina, optic nerve, macula, and blood vessels. The retina is a structure that converts light into nerve impulses, and these nerve impulses are sent to the brain through the optic nerve. The anterior and posterior chambers are filled with a clear liquid called the aqueous humor, whereas the vitreous chamber is filled with a gel-like fluid called vitreous humor. These fluids create pressure within their cavities and help maintain the eye's shape. Glaucoma is a condition that causes damage to the optic nerve as a result of increased eye pressure. The intraocular pressure is the fluid pressure within the eye, and it will increase if the eye does not drain it properly or if it produces more than necessary. As a result, there is an increased pressure on the optic nerve, which causes the optic nerve tissue to thin. Typically, glaucoma patients do not have any symptoms, and that is what makes the disease so difficult to manage. Unfortunately, glaucoma damage cannot be reversed because the optic nerve is part of the central nervous system and does not regenerate. Therefore, it is critical for patients to have regular eye exams and see their eye doctor to monitor eye pressure and health of the optic nerve. If there is a concern for a patient having glaucoma, or if the patient has already been diagnosed with glaucoma, they will have frequent visits with their eye doctor. At these visits, a patient interview is conducted where the patient is asked if they've noticed any changes in their vision or peripheral vision, if they have had any eye pain or halos around the lights. If a patient is currently on treatment, the compliance with medication is discussed. Another important piece of information during the patient history is knowing if they have any knowledge of a family history of glaucoma. After the patient history is obtained, the visual acuity is checked. This is performed with the correction on to obtain the best corrected visual acuity, both monocularly and binocularly. The extraocular muscles are tested, noting if there are any restrictions to the typical full range of motion. This is done using a tool and moving it in the shape of the H. Next, a screening of the patient's peripheral vision is done using confrontational visual fields, in which a series of fingers are presented in the extreme peripheral vision, one eye at a time. An intense light is then used to test the pupillary reflexes. The pupils are examined to determine the size of the pupil in bright and dim illumination. Then the light is used to test the pupil's direction and consensual responses to light, as well as how the pupils work together. Now the doctor will come in the room. The doctor will instill a drop of fluoresce in the patient's eyes. This is a medication that has an anesthetic to numb the front tissues of the eye and also has a dye to help visualize the eye. The doctor then uses a tonometer probe, which has a biprism that creates two semicircles. When the probe applanates the cornea, the dial on the Goldman tonometer is manually rotated until the two semicircles just overlap. The pressure is then read off the dial and documented in millimeters mercury. There is great variance in interocular pressure among patients from the morning to the evening and inter-doctor differences. Therefore, pressure alone cannot be used to diagnose glaucoma. The health of the optic nerve is the true underlying component of glaucoma. The optic nerve is a ring of tissue with a hole in the center. This hole, referred to as the cup, is where the blood vessels enter and exit the eye. The relationship of the cup size and shape to the overall nerve, disc, size, and shape is what is evaluated. The concern is, if the cup is large, is that because the nerve tissue is thinning due to increased eye pressure, or is that how the nerve developed and the tissue is actually healthy? Occasionally, a large cup is fine if the overall disc size is also large and the nerve tissue itself is healthy. The doctor evaluates all of this when viewing the back of the eye. Additional testing may be performed to evaluate the structure and function of the nerve. To determine the structure, how thick the nerve tissue is, an optical coherence tomography is performed. It compares the patient's optic nerve tissue to that of the statistical average for the patient's demographics. This test allows the doctor to see if there are any thinning changes apparent to the nerve tissue. To test the function of an optic nerve, a visual field is performed. This is an automated test that presents a sequence of lights to test the patient's peripheral vision. Then it maps the extent of the side vision that the patient can perceive. Glaucoma can be treated using eye drops, medication, and if neither of those work, then surgery. Thank you to Dr. Stephanie Sloan for all of this information.
created using Powtoon.